Hello and welcome to the Mindset Mentor. I'm your host, Tania Kolar, helping you live your best life. Well, on today's show, we are going to get into some deep conversation about healthcare and how to live your best life and feeling good because health is such a huge component to living your best life, right? So we've got our expert today, actually a returning guest and friend, Dr. Kwadwo Kyeremanteng. It's so great to have you back here on the Mindset Mentor. And I know that since we last had a great conversation, you have been up to some really great things, including a brand new show right here on Sauga 960. So, how about you tell us what the name is and a little bit about what the topic is going to be and what the listeners can expect?
Amazing. First of all, it is great to see you again, and it's a privilege to be on for the second time. I feel like I'm in special company, if I might say so.
Yeah,
But
baby.
uh, but yeah, I'm Kwadwo Kyeremanteng. The show's going to be called Solving Healthcare with Dr. K, and people are going to get two main things. One is I'm pretty passionate about helping people to get healthy. How do you avoid seeing someone like myself in the ICU? And what drove a lot of that was what we saw in the intensive care unit during the pandemic, how we saw a lot of people with metabolic disease, meaning obesity, type 2 diabetes, high blood pressure, that landed in ICU with diseases that were modifiable. And in other words, like if we gave them the tools to get healthy and turn this around, we might not be seeing them in the intensive care unit. So that's one of the major draws that people will get when they listen into Solving Healthcare. And the second is a topic that's really passionate of mine is how do we make our healthcare system more sustainable? How do we make it more efficient? How do we provide better care for our patients? Because as a frontline worker that does research on ways to improve the efficiency of our healthcare system, there are tons of gaps. And right now, the healthcare system is frankly in crisis.
Mhm.
And we need to collectively be thinking outside of the box on ways that we could help deliver care. People shouldn't have to go pay out of pocket for imaging if they're concerned about their breast cancer. They shouldn't have to wait 3 years to get their hip replaced. We need to, like, now is the time to think outside the box, to be innovative and treat the patients the way they need to be treated.
Oh, I love that. This is going to be, such a valuable show and deep conversations because you touched on so many points right there that really has such a huge trickle effect down the road. And there is, chaos in the world of healthcare globally right now and on so many different levels from patients to healthcare workers. I mean, it just goes on and on and on, and also to extended family of patients and healthcare workers, right? So there is definitely a need for improvement. So I want to acknowledge you for the willingness to put that message out there and to foster change and to say, hey, listen, something is not working and we need to fix it. So I just love it. Like solving healthcare right there. It's telling you that, okay, if we're solving something, that means there's a problem. And what I love, as a mindset coach, I always teach people that every problem has a solution. And it's a matter of delving deep enough and staying with it to find what that solution is. And, I think that personally, yourself being a critical care and palliative care physician, working with the sickest, the absolute sickest of people, in the intensive care unit, my goodness, I mean, first of all, takes a lot, and I acknowledge anyone who goes to that level because I think it takes a really special person to be in healthcare, period, full stop. But then when you go into, ICU and dealing with people in such a sensitive state, I think that takes a whole other level. And cannot be easy. Like I can't even just imagine some of the stress that you deal with, or that you see your colleagues dealing with, or you see patients and families struggling with. And I can imagine that that's such an immense weight on you. Tell us what that kind of feels like on a day-to-day basis for you.
Yeah, it's a great point, Tanya. Like we saw it during the pandemic, the weight. Like our jobs are pretty heavy in general,
Mm-hmm.
but you always look at what brought you to your job, and that was being there for patients, being there for their families, being there for each other. And there were times during this pandemic, unfortunately, that we couldn't do all the things that we needed to do. Like patients, like I'm in Ottawa, and patients had to come from the GTA, like Mississauga area, to because the hospitals were so overwhelmed, and to see that separation, to see people die alone, people being away from their loved ones was such a tragedy. And so those things were extremely heavy on healthcare providers. And we saw at some places a mass exodus of healthcare providers, like people that left the profession.
Mm-hmm.
But I gotta say, at a personal level, the what gets you through is that, if you're not doing this, who's doing it? Like, people are in a state where they're extremely vulnerable. You're in a state where your loved one is on a ventilator, their life is on the line. You don't know what the outcomes are going to be like. You don't know what the next hour, the next day is going to look like. And where I take a lot of pride is the communication piece. Like, if your loved one is on a ventilator, I want you to make sure that you have the information that you need to be able to sleep at night, and to know that, they're in the best hands possible. These are the steps that we're going to make to try and get your loved one through it.
Mm-hmm.
and
Mm-hmm.
and providing that communication side, providing that human connection, is where a lot of us find the gratitude, the gratification of the job. Like really thinking about how we can get somebody through such a tough time. And I honestly, I feel like I'm one of the luckiest guys. Period. I love my job. I really do love my job. It's exciting. You don't know what's coming through the door. You work as a team. You bond with your team, like your allied health professionals, the other doctors, and you do important work. And and you ask yourself, like, what makes your life most fulfilled, or what leads to happiness? It's purpose, right? Like finding that you have purpose. And those of us that are in this field, we have clear purpose. And it was
Mm-hmm.
very clear, especially during the pandemic, what our purpose was.
Yeah, invaluable, and then serving humanity. And you said a really key word, which I think is very important, is that communication. And people in a situation where there's so much fear and uncertainty can really spiral down quickly. So just that communication piece is so important. Yeah, and even if the situation is dire, I think that communication is still imperative, because if a family member has a small window to be able to communicate, what's deep in their heart, and those last moments, that is vital. I mean, that is something that, it's fleeting, and you cannot go back to that moment, and that's precious, to be able to know that, hey, maybe this is the time where you really need to communicate. And I'm thinking back to, as I'm saying this, my father passed away, several years ago, and was in palliative care. And I remember that one of my siblings, had to leave. He was in a hospice, and her and her husband left just for a little bit. And then the nurse came in and she said, "You need to call her, and they need to come back, like right now." Right. And they had been there for days, and it was just kind of one of those things. But she said, "No, you need to call. They have to come back, like right now." And I was so grateful that she communicated that, because, my father passed within moments. of her coming back. And so if somebody doesn't have that opportunity, oh, it's so like painful, right?
I um yeah, you're touching. First of all, I'm sorry to hear about your father. Um and second, what you described happens we see this so frequently as a palliative care doc, that there's something innate in people, like your dad hanging on to see your sister. We see this all the time. Someone's coming from Australia, someone's coming from the other parts of the country, and they will die within minutes after seeing their loved one. It's like almost like there's an adrenaline push that are keeping them alive so they could have that moment of connection. And
Wow.
I'll say that, like my father, we're going on almost 5 years in September, and my only regret is that I didn't get to see him. Like I didn't get to see him before he passed, and have that connecting moment near the end, or at the end of his life. But yeah, those moments are so important, and I'll tell you that's going to be a lasting memory. Like that's why what we, when we say what we do brings us a lot of purpose and gratification, is that nurse giving that phone call, or informing you to say, hey, get your sister over here. That was so important. That was like, that's a moment that no one's going to forget, that was
Mm-hmm.
involved. Yeah.
Mm-hmm.
So yeah, sorry to hear about your father.
Yeah, and unfortunately, thank you for that. And likewise as well for you. And so many people who are out there listening right now have experienced that loss, and it can just be, just so devastating and heartbreaking, whether you prepare for it or not, because sometimes it just comes out of the blue. Sometimes we have a little warning, or a fair amount of warning, but it's still so unique to everyone. And that experience, I mean, when you have a team of healthcare workers who can help to guide you through it, is just invaluable. I mean, like there's just so much that you don't even realize the impact sometimes that you have. Sometimes you see it, right? And I'm sure you know that through the gratitude that you experience from, patients and family members of patients. You may experience that gratitude, but oftentimes I think that it's almost like, um not that it's like there's no gratitude, but it's just you don't even know the impact because it's so far reaching, right? It's so
Mm.
far reaching. And so I think it's so important, for everybody to be kind to people, and just to, put your best out there. And I know that not everybody has a great day, and there's going to be moments where you say things or you do things that you're not necessarily like, proud of, or you wish you could have done it differently. Don't beat yourself up, people. It's not about beating yourself up. We all make mistakes in life, but I think it's important to say, and sometimes acknowledge that, even to say, hey, listen, by the way, I'm sorry that I was a little bit this or that, or insensitive. But just help people to understand. Again, it goes right back to what you said: communication on so many levels, right? It's just how we all can survive on this planet together, and to truly live our best lives. I think that's really crucial to our mental health and well-being.
100%. 100%. And I can't reinforce enough how, communication and connection is healing. It really is. Like, the first episode we're doing is with my wife, Kyeremanteng, who's a clinical psychologist. And we talk about how post-pandemic we really need healing. So many people need to heal. And that a lot of that comes from connecting, to being real with each other, and at times being vulnerable, but finding that way to feel connected, and and that is through, communication. That is through being kind and compassionate, not only self-compassion but compassion towards others. One of the topics we talked about is how everyone just seems a little bit edgier these days, that
Mm-hmm.
they there seems to be that little bit less patience, a little bit more anxiety, a little bit more leaning on the horn, or people being more impatient. So yeah, I think this is a good reminder, Tanya, is like, yeah, be not only self-compassionate but compassionate to others, connect, and we'll get through all this.
Yeah, we will get through it collectively together. And anyone listening right now that is going through a crisis, please reach out. I mean, there's so many wonderful, tools and organizations that you can reach out to get the help that you need. Don't go it alone. That's why I love to have incredible guests like Dr. K, Dr. Kwadwo Kyeremanteng, to really have these conversations, to let you know that we've got your back. You're not alone. I think one of the trickiest things, and the thing that we've all, I think, experienced through the pandemic, is that feeling of, oh my gosh, like isolation and loneliness, feeling alone and just being disconnected. And that can be a scary thing. But when we know that we're not alone, no matter what, whether you're in a room all by yourself for a very long period of time, you're never truly alone. And it does take some, maybe getting used to, or a mindset shift to kind of understand, right, that you're not alone. But it's true, you really are not. And, I want you guys to stay tuned and have a listen to more with Dr. K right here on the Mindset Mentor. I'm Tania Kolar. And you got to make sure you tune in now, Fridays at 3 p.m. You're going to be listening Thursdays at 3 p.m. to the Mindset Mentor, but hang out on Fridays. 3 p.m. is a hot, hot, hot time. So right here on Sauga 960, it is Solving Healthcare with Dr. K. So we're going to talk a little bit more about how we can solve and help you solve healthcare concerns after we come back from this break. Stay tuned. Welcome back to the Mindset Mentor. I'm Tania Kolar, helping you live your best life. And I hope you woke up feeling absolutely phenomenal today. But listen, the reality is that, we don't wake up feeling phenomenal, at least not every day. I mean, I'd love for everybody to be in that place. But most times, you get out of bed and you think, oh my gosh, I don't want to get out of bed. You don't love the work that you do, or, the circumstances that you're dealing with, or the depression and the anxiety that is kind of overbearing, right? So we're going to talk today about, how to solve some of our concerns. And somebody that gets out of bed and absolutely loves his job is my special guest today, is Dr. K. Dr. Kwadwo Kyeremanteng, affectionately known as Dr. K, who really truly is passionate about being a physician, dealing with critical care situations and palliative care patients, but also bringing awareness to the healthcare system, which I think is just super cool and like so fulfilling. He's also the founder of the Research Optimization Network, right? So that's kind of this multidisciplinary group that's working to look at how to reduce spending, like health spending, without, here's the key component, right? Without reducing the care, right? So that's really important. You don't want to compromise care, but you also want to be able to deliver, the most advanced technology and services available, right? That's out there. So, Dr. K, thank you so much for being here on the Mindset Mentor and having these conversations. And your show that's coming up here on Sauga 960 that is launching Friday. So every Friday at 3 p.m., tune in to Solving Healthcare with Dr. K. So we're going to get a little sneak peek here at some of the topics that you can, hear on the show. And let's kind of delve into some of your favorite things. I think that you love to talk about is metabolic disease. And that's a big one because I think so many people can relate to that, right? For sure.
Oh my goodness. First of all, once again, this is really excited being here for a second time. So thanks for having me on the show. But I don't know if I'd be here if it wasn't for the passion on about getting people healthier and addressing metabolic disease. And a bit of the story was that we saw a lot of metabolic syndrome in the ICU related to COVID. So diabetes, high blood pressure, obesity, high cholesterol. And one of the things that I didn't realize going through medical school and having all this training is that through lifestyle modifications, these things can get better, and if not even reverse. Your diabetes, type 2 diabetes, can be reversed. Your blood pressure medication, you could come off blood pressure medication. And so when I'm finding out about this, I'm like, why are we not screaming this to the world? And this is a topic that I'm really passionate about, because when you get healthier in this way, when you lose the weight, when you reverse your type 2 diabetes, you are living longer, you are more functional being. Like if you're the 68-year-old grandmother, now you're playing with your grandkids, you're active, you're the active grandma. All of a sudden you are having more mental clarity and improving mental health symptoms. One of my favorite topics of late is Dr. Chris Palmer's work on how improving metabolic disease actually can cure some mental health disorders, and really how metabolic disease is an extension of mental health. And so
Wow.
when you address all these things, you really are improving so many people's well-being. And then you were mentioning our research group. You talk about the ultimate way of saving healthcare dollars is not putting a foot in the door. So when you do reverse your metabolic syndrome, your type 2 diabetes, all of a sudden you're not needing to be in the emergency department because of your foot infection related to diabetes. You're not having complications from surgeries. You're not needing your knee replaced because you've lost your weight. Like the bang, there's the hugest bang for your buck, in my opinion, is when you invest in prevention. Full stop.
Mm.
And that's why I get so excited about this. So when you jump on the show, when you check out any of our content, whether that is the podcast, the show, or some of our content on social media, you'll be empowered, folks. You'll feel like you got this. You have the ability to get healthy, know what foods to eat, how to eat, when to eat. You'll get the sense of what exercise gives you the biggest bang for your buck. You'll get a sense of how to reduce your stress, how important sleep is, and how to get some tips on how to improve your sleep. And then most importantly, as we talked about in the previous section or segment, connection, why that's so important, and how you can incorporate that into your overall wellness strategy. So yeah, you get me going, Tanya, when it comes to metabolic disease and prevention. But yeah, that's my baby.
Oh, I love it. I love it. And it's interesting because you were even surprised by the results that people can experience, right? By making some shifts. And that preventative piece is so key, but it's also very empowering to know that we can, do something ourselves, and take our health into our own hands, so to speak. And listen, I'm not saying that you're not going to go see the doctor because they're invaluable. You got to go, right? But let's do what we can to help ourselves because it's so important. And I know that, and I can speak from personal experience too. I know that when I'm stressed, I do the stress eating, and, I indulge in the unhealthy foods because there's, I think, a comfort, linked to that. Or I don't know, I kind of crave carbs sometimes. But I find the more carbs that I have, the more I want. The more junk food I eat, the more my body craves it. But I also know on the other side, when I eat healthfully and mindfully, man, do I ever feel great. And I see the difference. I can feel the difference in my physiology, right? Yeah, exactly, right? Feeling great. And there's a world of difference when you have that clarity, cognitive function is there, right? When you eat healthier. I know at one point I experienced it was a period, I was going through a lot of stress, but I was having brain fog. And then I finally figured it out. I was like, you know what? It is my diet. It's what I'm putting in my body that is really not helping me. And then when I made the shift, it was kind of definitely not immediate, but it was really quick, right? The results were, just surprising and shocking. So I'm just wondering if is that something that you see with patients coming in? Do you physically see the difference? Do you see it mentally, physically? How does that manifest?
honestly, by the time they come to us in the intensive care unit, it's hard to divulge like a lot of their eating habits and so on. But it's more since we've been advocating for it, like through social media and through our show. It's
Mhm.
been the stories people come to you with, and really hearing firsthand how stories similar to what you described. I had that mental fog in the afternoons. I was so sluggish. I wanted to take a nap, and I made the slightest modification. I started eating a little bit later in the day. I reduced my processed foods. I increased my protein intake. I uh, reduced the amount of simple sugars or sugars in general that I ingest. And wow, I lose weight. I feel stronger. I'm more mentally clear. My mood has improved. So many stories like this where people and like we got to remember, like we're coming out of a phase where a lot of people were struggling with so much of that, right? Like
Mhm.
call it the COVID, what they call it, the COVID-20, where a lot of
Yes.
people put on the
Yeah.
extra pounds,
Hmm.
the mental health concerns. So there was a lot of people in that box where they were just really struggling. But you got to put it into context too, where I'm not that far removed from medical school, 20 approaching 20 years here, and the amount of education we got on nutrition was minimal. Like it
Hmm.
really was. And we focus on the life-saving measures, the more acute ways of saving a life, but the amount of education you get towards nutrition really is minimal. So this is why I think when it comes to a lot of wellness, nutrition, fitness, all these things, sometimes unfortunately there's that knowledge piece, people have to take it on themselves. Like this is something that you're going to be have to be empowered. You're going to have to do the research or find that trusted source, because this is not this is not common studies within medicine, unfortunately.
Yeah, and so, why do you think that is? Because the results that people have seen have been amazing, and you said yourself that you would, why are we not screaming this from the rooftops, right? So what is it? Is it that people just don't want to sort of uh find a different path, right? Because it's familiar, and that medical history in schooling is just very sort of locked in? Or is it pharmaceuticals, and the money that's being invested, and they don't want other options? Like, what do you think? I mean, we don't know for sure, but do you have any thoughts on that?
Yeah, no, it's a good question. I think it's everything that you have mentioned so far. Like the fixing what you eat isn't sexy. There's from a pharmaceutical perspective, there's not, there's no gains there. I'll say this: in medicine, we're stubborn dinosaurs. We don't adapt to change very well. Like when new studies come out, and
Mm-hmm.
it takes a while to transition. And traditionally, when we look at the highest standards of medical studies, like randomized controlled trials or systematic reviews and meta-analysis, there's not too many nutrition studies that meet that standard, right? So I think that's part of it too, is if you're going to meet the highest standard, we're not seeing that much when it comes to the nutrition studies, because they're harder to do. There's a lot of factors that are outside of the study that might influence things. That's a part of it. But honestly, this is why I think the message is take it on yourself, folks, that this is it's your body. It's it's you're not always going to be able to get all the information from one person, one physician, but do your homework, find that trusted source, see what works for you. And that's the other thing too, is what works for one person is not necessarily going to work for another person. Like in our house, one of the ways of reversing diabetes that I think is most effective is a ketogenic diet.
Mm-hmm.
So in my house, my wife and I both tried it. I was absolutely miserable. It did. It did not. I lost 5 pounds. I didn't need to lose. I think I was trying to keep up with fluids. I thought I was. Maybe I wasn't. But she was thriving on it. She was like a new person, mental clarity, everything like that. And I'm like, I'm carbs. I need carbs in my life. Like I don't need it to be the front centerpiece, but it needs to be part of my life. So find what works for you, and before you know it, you'll be feeling better and talking the way Tanya was mentioning, moving better, thinking better, having that mental clarity. You got this.
Oh, I love that. And that's so inspiring. And to know that you can, really customize something and see what feels right. When you start to make those changes, obviously you want to give it a little bit of time for it. Maybe it takes some time to kick in. But if you know that you've been doing it and it's just not working, then maybe try something else, right? We have lots of options in life and we sometimes get very fixed with that fixed mindset and we continue to do what no longer works, right? So it's an opportunity to really take control of your health. And I want to say thank you, Dr. K, so much. Unfortunately, we're out of time. We could talk all day long. Great information. And I love your passion for what you do and for really helping to educate people on what's available to them and the power that they have within. So thank you so much for being here today.
It is an absolute pleasure. And please keep doing what you do. The people need to be tuning in at 3 o'clock on Thursdays and really learning the ways of adjusting that mindset and thriving again, not surviving, but thriving.
Thriving. That is it. We love to thrive. Well, that was the fabulous Dr. Kwadwo Kyeremanteng, or Dr. K for short, who is a critical care and palliative care physician at the Ottawa Hospital. He's also the founder of Research Optimization Network, which is a multidisciplinary research group working to reduce health spending without compromising care. And sometimes that's a tough one, isn't it? Right? We certainly need to have better healthcare available to us, and also advanced technologies. Right? It's out there. There's always so much research that's happening, and we also want to have that human component and have that communication throughout, which is something that we talked about with Dr. K and how important that communication is on many levels of healthcare and in the system. So it's really great to have these conversations, and I got to tell you that, like Dr. K, who gets up and loves what he does and finds his job super fulfilling, I share that sentiment that I love what I do. I love having great conversations like this here for you with guests like Dr. K, who can share their knowledge, their expertise, their wisdom and experience, and also stories of working with other people, because collectively we're all one. We are the same. And, we all have different personalities. I mean, there's, about almost 8 billion people on the world, right? On the planet. And we're all unique. Every single one of us are unique, but there is something that unites us all. And we're one and the same in that regard. And I love that we can inspire each other. I believe that we are all lifelong learners and we learn from each other. I've always loved books and shows and podcasts and all that kind of stuff. But, it's like that's where I have absorbed so much knowledge since I was about 15. I've been reading books on self-help and personal development and psychology, because I just cannot get enough of this information, because it's been so impactful in my life. And I have truly learned how to optimize my mindset, how to reprogram limiting beliefs. And if I can do it, then you can do it. So for me, the Mindset Mentor Show is such a gift for me to be able to share that and to inspire you and to motivate you to really start to work on your mindset. And sometimes it just takes somebody else to help you see that your mindset is maybe a little bit out of whack. There's something maybe that's not empowering you, or that is continually disempowering you. And when we can get that awareness, I think that is so essential, because we can change our lives for the better by making sometimes small changes. And again, that awareness piece is such a huge factor. So I encourage you to check in with yourself throughout your day and maybe listen to your language patterning, some of the constant things that you find yourself saying that can be an indicator as to your subconscious mind and what's sort of working on in the background, those limiting beliefs that play out in many different ways. It's I call it the silent dictator buried in the subconscious mind that really truly dictates your entire life, and the results that you experience are linked to what's going on in that subconscious mind. So it's important to really do what we can to program our mindset so that it is working for us, not against us. And I know we can certainly be our own worst critics, but I want you to be your BFF instead of your own worst critic. Support yourself. Listen, we all make mistakes in life because that's part of being human. It's a side effect of being human, making mistakes. So please don't beat yourself up, right? Let's learn from those mistakes and be empowered moving forward so that now we can do things better. When we know better, we can do better, right? And oftentimes we could just look at it this way, that we all do the best that we can given the information that we have in that moment, our understanding, our awareness, wherever we are. So I want you to give yourself a break, truly give yourself a break, give yourself the love and the TLC that you would give to somebody else in your life that you love, right? Because the things that we say to ourselves, often we would, or no, I wouldn't say often, I think we would never say some of those things to somebody that we love or just even like. Right? We can tear ourselves down. So I really want you to be a support system for yourself. And again, don't feel as though you're going through life alone, because there's so many vehicles available to you to reach out to friends, to loved ones, to support groups, to healthcare workers. Find community groups that you can reach out to. Listen to shows like the Mindset Mentor here to be with you, and also don't forget to tune in to Dr. K's new show that's launching right here on Sauga, 9:60 a.m. Fridays, I should say, at 3 p.m. The Mindset Mentor is Thursdays at 3 p.m. But 3 p.m. is a hot time here on Sauga 960. So put it in your calendar. Tune in, uplift your day with some friends. It's friends supporting friends. It's for me, my goal with the Mindset Mentor Show is to help to educate, motivate, and inspire you to live your best life. And I can do that by having great guests who can share their wisdom, knowledge, experience, and expertise. And we can all do that collectively. So if you have an experience that you've gone through and you find it troubling and you don't want to share that, it's actually a win-win when you can release some of that stress that is locked in the body, right? When we hold on to things and when we keep everything stuffed down, but you're also helping and inspiring other people who will say, oh, isn't that interesting that they've gone through that experience, which is so similar to what I was dealing with or feeling. It's, you never know the impact that you can have on somebody's life. And you may never know, but I think it's important to just do what you can to stay positive, uplift humanity, uplift yourself, be supportive of yourself, and be on your side, be on your own side, right? Be your BFF. I don't want you to be that critic, that inner critic, the loud voice that runs incessantly on repeat, on loop on your mind, beating you down. Well, I want to raise you up, and I want you to be on board with that, to be your true supporter. So I want to thank you all for tuning in today and joining a great conversation with my special guest, Dr. Kwadwo Kyeremanteng, or Dr. K, who really helped us to understand, what's going on out there in the healthcare world from both a patient standpoint and the healthcare providers as well. Some of the things that they're dealing with, and also really fascinating to learn about metabolic disease, and high blood pressure, and the connection of nutrition, and some of the things that we can actually do to change our health in that regard based on, that. Also, one thing that Dr. K had briefly mentioned that I'm sure you'll hear about more on his show, Solving Healthcare, Fridays at 3 p.m. here on Sauga 960, is sleep. He talked about offering some tips on how to get a better sleep. And I got to tell you that I think that that's one of the most underrated benefits of all, is sleep, right? Having a great night's sleep is imperative to your well-being. As we're sleeping, our body's actually healing and rejuvenating. And when you're not getting a great night's sleep, or when it's a broken sleep, you're not getting in that proper sleep state to be able to heal and to rejuvenate the body, or to have that mental clarity when you wake up. So try to get better sleep. Maybe it's going to be, reducing caffeine intake, several hours before you go to bed. Maybe it's going to bed a little bit earlier than normal, right? Or just watching some of the foods that you're eating before nighttime, or having a cutoff time as to when to not eat, too soon to sleep. So more of that great information, of course, on Solving Healthcare, Fridays at 3 p.m. with Dr. K. And of course, I'd love to see you and have you join us Thursdays at 3 p.m. and tune in for more of the Mindset Mentor.